Thanks, Amy, and thanks everybody for having us today. As Amy mentioned, I'm going to try to cover a lot of ground in 20 minutes. So I'm going to share with you a bit about how we view the role of engineers in working globally through the Mortensen Center in Global Engineering. I'm going to give a few examples of our research and our practice and our partnerships. And I've also included a few call outs specifically for this audience, including how we work with professional staff around the world, how we engage with a diverse student body, and what are the research products that can come out of this applied work. So this is our context. Of course, this place looks familiar to all of us. What I like about this picture is that it's not a graphic. It kind of looks like a graphic, but it's actually a series of stitched pictures of every place on Earth on a cloud-free day. But it looks like a familiar place. So this is another way of looking at the planet. I know most of you have seen this picture before. Of course, what we see here is lights and electricity. And oftentimes, your first thought might be that this shows where people live, but it really shows us where rich people live. It shows us where we are in North America and in Western Europe, and the Nile is lit up there in North Africa, and India and China are outlined. But we still have 3.5 billion people in the world who use firewood for their daily energy needs. And that's where these people live. Most of this infrared light are household cooking fires for cooking and staying warm. And the emissions from these stoves contribute to one of the leading causes of illness and death globally, which remains respiratory disease, even in 2020. We have 2 billion people in the world, even in 2020, that don't have safe sanitation, and over 1 billion people that don't have access to safe drinking water still today. And climate change is starting to impact these low-income communities severely and already. The first impact we see from climate change is changing rainfall patterns. So wet places are getting wetter, and places that are prone to flooding are seeing more severe and frequent floods, and dry places are getting drier. Drought is now almost an annual occurrence in East Africa instead of every 10 or 20 years. And associated with floods and drought are crop failures and displacement of people and death of livestock and political and economic and social insecurity. This is another image of the planet. I did this one for a show. This is aerosols. So over North America, we see fires, forest fires. And over Africa, we see a combination of fires and household fires and dust storms over the Sahara and typhoons and hurricanes out in the ocean. So here's another way of looking at the planet. Here's who's using energy and electricity. It's us. The United States and Canada have the highest emissions per capita of any country in the world. And the United States is the single greatest historic emitter and total emitter of all time. You might have heard that China passed the United States a few years ago. That's true overall, but not historically and not per capita. We're still by far the greatest contributors to emissions. And then we look at who's still sick in the world. This is the global burden of disease. It's almost the inverse map. If I go back and forth for a second, here's who's using energy. Notice that in sub-Saharan Africa, which is home to 70% of the least developed countries in the world, there's practically no energy use to speak of still today. And this is also where there's the greatest burden of disease. And in a time of COVID, where we have one of the simplest measures that we can take to stop and slow the spread of COVID-19 is washing your hands with soap and water is actually inaccessible to billions of people. In rural Kenya, only 10% of people have soap and water at their home. In rural Ethiopia, only 4% of people have soap and water in their home. So these are massive inequities and inequalities that still exist today. Of course, the world's made progress. You've seen some of this data before. This is deaths among children, the top causes in deaths among children under the age of 5 over the past 30 years. And over the past 30 years, the deaths attributable to respiratory disease have plummeted from 11 million people to fewer than 4 million children, diarrhea disease from 8 to 3 million, etc. But most of this progress is not happening in the least developed countries. It's not happening in the places that are actually the subject and the object of development funding and international development practice. It's mostly happened in India and China, which is predominantly a consequence of national priorities. So when you see South Asia and East Asia have dropped in the number of people that are in absolute poverty, while sub-Saharan Africa is actually slightly creeping up, this is China and India that deserve credit for this reduction in child mortality and poverty. And of course, that comes at the expense of increasing emissions globally. So if we look at sub-Saharan Africa, home to 33 of the 47 least developed countries, this is our focus in large part of development funding and international development aid. And it seems like a lot of money flows to sub-Saharan Africa every year. About $20 billion per year flows into sub-Saharan Africa in the form of foreign aid. That's that teal box right here in the middle. In addition to that, remittances, which is people living outside of Africa and sending money home, is about the same size as foreign aid. And foreign investment is also about $20 billion a year. And then right up here at the top, you see philanthropy. When I made this chart, I was actually pretty surprised. You know, the Gates Foundation and other big philanthropies get a lot of attention. It's a tiny fraction of the money that actually is invested in the least developed countries. But you also subtract from these investments money that is leaving Africa through a combination of tax avoidance, trade misinvoicing, and payments on debt that was accrued back in the 70s and 80s. And so the net is only about $20 billion a year. That might seem like a lot of money, but it's about $20 per person is invested in Africa. And in fact, large fractions of that investment will actually flow into organizations based in the United States or based in the European Union. Some of this money actually counts for my salary and my colleagues here at CU who practice in this field and might get money from USAID that is ultimately supposed to benefit Africa, but it might not actually transact in Africa. So within this global context, we've been rethinking the role of engineers in contributing to global poverty reduction. Over the past 50 years, and really especially over the past 30 years, there's been a big emphasis on small-scale product and project level work. So working in a village on a product or a project designed to address the symptoms of poverty, like water quality or air quality. But we haven't really been able to effectively address the causes and drivers of poverty. So how can we elevate the role of engineers to still be technical, to still do projects, to still care about products, but change our lens to also considering the symptoms of poverty and what possible solutions there may be. So things like standards development, system science, looking at the entire system behind a water service and not just the water pump or the water filter by itself. Impact evaluation, something that the global health and development economics community has been emphasizing for the past 15 years at least, using experimental and quasi-experimental methods to figure out what works and what doesn't work. Data, or in particular instrumentation and remote sensing, a particular area for our research group, which I'll expand on. Contracting, this might sound a little obscure, especially for engineers, but actually strengthening the accountability and the contracting mechanisms behind sustaining services. Structures and settlements, anything from footbridges to refugee camps. Environmental health, of course, typically the core focus for global engineering, but of course not the only thing. And education, what we do here at the Mortensen Center, what's done in Michigan and MIT and Berkeley and Toronto and a number of other peer universities. So I'm going to go into a few examples from our particular research group. One big challenge in global development is that the money comes in linearly. Money comes in from a donor and it goes into technology. So water filters, cook stoves, off-grid lighting systems, water pumps that are designed to help people. But that impact is often short-lived. About half of water and sanitation projects are broken within the first 18 months. We don't have feedback between the impact and the actual funding allocations. So how can we close this loop? How can we have a water pump that is monitored? That monitoring is used to enable maintenance, and that maintenance is incentivized with payments so that we can create a financially sustainable basic service like access to water. So here's a few examples of where we've done this. This is Rwanda. Most people in Rwanda use household fuels, including firewood and charcoal, and it contributes to the emissions that you can see. People get their water from surface and shallow groundwater sources. About 70% of household water supplies are contaminated at the point of consumption. So over the past 17 years that I've personally been working in Rwanda, we scaled several nationwide programs, and a few years ago reached about 2 million people with water filters and cook stoves. We covered everybody in blue here in the Western province, in the poorest quarter of households, everybody in green in the Eastern province. And we ran a randomized control trial with the London School of Hygiene and Tropical Medicine and Emory University, evaluating the health impacts of these stoves and filters. This project had a lot of partners: the Ministry of Health, the company we were working with, Del Agua, a number of research partners. Primarily the funding came from Del Agua, but also funding was provided by the World Bank, and Ashok contributed. You might not remember, but a number of years ago, Ashok won a large grant from USAID, the Higher Education Solutions Network, and part of that funding came to our team to study the adoption of these technologies in Rwanda. And we had additional funding from DFID and a number of other sources. This is the cook stove. I won't belabor the technology, but we focus both on the technology and the behavior change and the health impacts. We have to be multidisciplinary. The technology by itself is not sufficient. You're not going to invent a cook stove that works if you parachute it out of a plane. It has to be combined with public health messaging, with financing, and with impact evaluation. And this is the water filter. Highly effective water filter, same deal. By itself, it doesn't work that well. In fact, these technologies, both of them, can reduce health. If you start using a water filter only intermittently, you can reduce some immunity to bacterial contamination. So you can actually get sicker if you provide a water filter that isn't used exclusively. With the cook stove, I'll go back for a second. Often people will stack their cook stove with their baseline stove. So if you're not careful, emissions can increase and fuel consumption can increase when doing a cook stove project. We ran this project with the Ministry of Health as a social enterprise. We invested private sector money in the program, and it earns carbon credits under the United Nations that are still today earned and sold to the World Banks as a financial mechanism to support the initiative. We had 900 community health workers working with us across the country over a couple-year period. This is some of the messaging we provided, working closely with public health professionals. And we also did some of our first work with instrumentation. We installed cellular connected sensors inside these water filters so that we could measure what people really do. And we saw a significant difference between what people tell us they do using surveys, what people do when they know a sensor's in their home, and what people do when they don't know a sensor's in their home. So we see bias in the surveys, and we see reactivity when you know a sensor's there. This research resulted in a number of publications when I was an assistant professor in environmental science and technology. That was part of my tenure case and part of supporting our students. At the end of the RCT, we established that we doubled the number of households with clean water. We reduced indoor air pollution by 73%. We reduced diarrhea by 30% among children under 5. We reduced respiratory disease by 25%. And we saved 90 children's lives, averted deaths every year that the program ran, for a total of aggregated avoided illness of 7,500 years per year that this program was running. This has resulted in a ton of papers. We've had process evaluation papers describing how the program ran. We've had geospatial and statistical papers looking at the determinants of use. We've had a PLOS Med article presenting the results of the randomized control trial. And we have an article in Development Engineering, which is run by Amy and Ashok, on the cost-benefit analysis of this project. We've built on this since then. This is a current ongoing project funded by the National Institutes of Health and the Gates Foundation, where we're looking at the health effects of clean cooking. And our role is a feedback sensor where we monitor air quality, and we show this as persistent feedback to households. One of our star PhD students, Chantal Irabagiza, is from Rwanda and is finishing her PhD with us here. She just had an article on the design of this technology, so the mechanical side and the human-centered design side, in the Journal of Exposure Science and Environmental Epidemiology. Chantal's also worked with us on a number of projects around rural water supply. This is a broken hand pump in Rwanda. And sorry, those are coming out of order. And Chantal worked with us to install sensors monitoring rural hand pumps so that we could identify broken hand pumps and go and fix them. This work has been funded by USAID, by UK DFID, by the National Science Foundation and the World Bank, and has resulted in a number of papers, including papers on the actual study, papers on machine learning to statistically analyze the data, and a few others. The idea here is that if we see a hand pump's broken, we can go out and fix it and see if that improves cost-effective rural water services. And we've had a big impact. Typically, when these pumps are broken, they're broken for about 200 days. Chantal and our team were able to bring that down to 20 days and bring average functionality from 50% to over 90%. So we've built on this now at scale. Our latest initiative is called the Drought Resilience Impact Platform, DRIP, that's focused on reducing drought emergencies in East Africa. Another one of our star PhD students, Dennis Machara, is actually based in Nairobi, Kenya. He works full-time for the Regional Center for Mapping of Resources for Development. His salary is paid for through a grant from USAID, and he does his PhD with us here at CU while actually working full-time in Nairobi. This is our context for DRIP. These are no longer hand pumps. These are large-scale borehole systems that provide water during times of drought to people and livestock. And we're currently monitoring over 3 million people's water supplies on a daily basis. Our theory of change is that better monitoring, both in situ and remote monitoring, can improve drought and groundwater forecasting, which we can link to contracting mechanisms to go and fix water supplies before they break and before the drought hits. And we're currently operational with this. Each one of these dots is a water supply for about 5,000 people in Kenya and Ethiopia. In total, we're monitoring 3 million people's water supplies daily, and we're partnered with the Famine Early Warning System, who provides that food security colored legend that you see in the background. And this work has been funded by NASA, USAID, and the National Science Foundation. And we've had a ton of papers out of this too. A paper in World Development about who actually pays for water services, which is starting to influence the conversation and development around self-sufficiency versus accountability from donors. We've had several articles in Science and the Total Environment, including the one here in the upper right, was co-authored with drought experts at the Ministry of Water in Ethiopia and the National Drought Management Authority in Kenya, and experts at USAID in the Center for Bureau for Resilience and Food Security. Okay, outside of the water world, I'm reaching the end here. I just wanted to highlight a couple other cool projects. This is a pedestrian footbridge. It provides access to communities that are sometimes isolated by floods. The organization that installs these is called Bridges to Prosperity. They've put in hundreds around the world, and they're currently putting in 300 in Rwanda. Our team has been funded by a donor and USAID to do a 5-year health and economic impact evaluation. So we're studying the health impacts, the economic impacts, and the determinants of use of these footbridges. Our team are the leads, but we have economists on the team and public health experts on the team. And Laura McDonald, who's the managing director of the Mortensen Center, runs this research initiative in Rwanda. We've had a few papers out of this. One cool paper that a master's student contributed to, actually a bachelor's and master's student, Sally Gerster, pictured there, where we installed cameras on the footbridges and tracked use. And we just had a paper out in PLOS One just last week. We also contribute to some of the non-journal article literature and discourse in this field. We're part of Engineering for Change, like the rest of the speakers here today. Wrote a book this summer on the global engineers, profiling engineers working in this field, and also putting forward the idea of global engineering, or at least, obviously, we don't claim it, but contributing to that discussion of what it means to be an engineer working in global development. Books on contracting and impact measurement, and a book that was contracted by the World Bank on measurement technologies for water and sanitation. So just to bring that together, we do this work inside the Mortensen Center in Global Engineering at the University of Colorado Boulder. The Mortensen Center is part of the College of Engineering. Most of our students come out of civil and environmental engineering, but we have students in computer science, electrical engineering, aerospace, mechanical, biomedical engineering, and we want more students from all of the departments here at CU. We have about 200 undergraduates taking our courses, and many of them earning our global engineering minor. We have 70 graduate students either earning our graduate certificate in global engineering or our professional master's in global engineering. And those students work in 20 countries around the world. And in non-COVID years, we have students traveling to do their field practicums in 20 countries around the world. And as a research center, we do about $5 million a year in research expenditures. We also have very active student chapters. So Engineers Without Borders was founded here at CU. I got involved when I was a freshman here in 2001, and they're still running the same projects around the world. And we have a chapter of Engineers in Action that builds these same footbridges. Paula Perez is one of our great undergraduate students. Paula is originally from Colombia and is now working in Rwanda with Engineers Without Borders. And our students also organize a conference, the Colorado Wash Symposium. Ayush Shahi is originally from Nepal and is currently running the conference this year. And we invite all of you to participate virtually. Abstracts are being accepted right now. So that's the brief overview of the Mortensen Center, Global Engineering, and our particular activity linking public health, engineering, economics, and policy into work that both is applied but also publishable. Thank you.